You mentioned earlier that you, part of your participation in the program was to do individual feminist counseling. Can you give us a sense of the kinds of problems and situations that you as a feminist counselor dealt with?
A lot of relationship problems. Often with a boyfriend. Sometimes if it was a lesbian client, it would be with a female partner. Sometimes it would be a cultural thing. Someone from an East Asian culture who had absorbed some Canadian socialization and into big conflicts with the family, her family of origin, and being pulled one way by a fellow that she was enamored with, and then being chastised and criticized, and her freedoms limited by the family and their cultural orientation. So those would be some of the examples, I'm actually thinking of real real situations now. One woman was struggling with what her sexual orientation was, and so I was involved in with her for quite a while. Another woman was post-divorce, and that was quite recent, and so exploring that. And another person had and was abused, seriously abused in childhood, and she was ready to deal with that as a mature adult. So those were the kinds of things that I saw.
Where and how did you get your training as a feminist counselor?
There was no training.
I was going to say, the field of feminist therapy.
Nobody was trained as a feminist counselor.
So
how did you
figure it out? Yeah. How did you figure out what to do? What was that like for you, being on the other side of the
well, I was teaching a course on women's sex roles in society. And so the material there, the people who were working on issues there, whether it was intentional or not, some of what they were saying was relevant. And in psychology, there was a gradually burgeoning body of research critiquing traditional modes of therapy, and not just psychoanalytic, but all other traditional modes of therapy, and critiquing treatments such as drugs, prescribing drugs for women. So you could take from these critiques a sense of, well, if that's not the right way to do it, what would be a better way of doing it? So one of the things to keep always in mind was a bias or a belief that the person that you're talking to has been well socialized into traditional sex and gender roles. And so as a counselor, you're sensitive to that and pointing out when the thinking or the behavior or both was simply a knee-jerk reaction to the traditional socialization. So part of what would go on in the sessions that I conducted was an explanation of you are who you are in part because of this history. And this history is of long standing, it's normative, Probably everyone you know reflects these patterns to greater or lesser degree, but that doesn't mean it has to be that way. That doesn't mean it's the best way, the right way, the appropriate way, and so on. So, and then there would be, you know, opportunities to explore, well, I could have said this, or I could have done that. Yes, you could have.
Yeah.
Next time, maybe you will. So, you know, that's...
So you're really taking from where your teaching and academic interest and intellectual interests were and trying to translate that into the clinical situation,
That's right.
the counseling situation. Yeah. Can
Exactly.
you